I'd like to welcome everyone to the Vasculitis Foundation webinar today. I'm Kathy Olewski, and I'm the host for the Vasculitis Foundation Educationals webinar series, but I'm also a patient living with MPA vasculitis. And in today's webinar, we're going to have a great roundtable with patients and Dr. Sri Banerjee about those questions that we call the cringe questions. They're the questions that we get asked as patients and never quite have the right answer. So we hope today in sharing our thoughts that we all will have improved responses to those questions. And I first need to say that these webinars are part of the Vasculitis Foundation's commitment to patient education. And we'd like to thank our sponsors, Amgen, AstraZeneca, and Novartis, for supporting these webinars. And we're super grateful to have with us today Dr. Sri Banerjee to share the perspective of a doctor treating patients with vasculitis. Dr. Banerjee is an assistant professor of medicine at Perelman School of Medicine at the University of Pennsylvania. She earned her medicine and surgery degree at Calcutta Medical College in India and her MD in biochemistry at the All India Institute of Medical Sciences in New Delhi. She did a rheumatology fellowship at NIH with an additional year of training focusing on vasculitis. Dr. Banerjee is a rheumatologist specializing in vasculitis and relapsing polychondritis. Welcome, Dr. Banerjee. We're so appreciative of having you here to give your perspective as we all talk with patients today.
Thank you so much for the introduction. I'm delighted to be here with you all. Thank you.
And the one thing I need to ask you, Dr. Banerjee, before we get going is, do you have any disclosures?
I do not.
Okay, thank you for that. And now I would love to introduce my fellow patients, and I'm just going to kind of go around and let you all introduce yourself. And I think I'll start with Trina, if that's okay.
Good morning. My name is Trina Anderson, and I live in the Phoenix, Arizona area, and I was diagnosed with GPA back in 2015.
Thanks, Trina. How about you, Joshua?
Well, I'm Joshua Roberts, and I am just outside of Seattle, and I've struggled with EGPA since about 2018 and officially diagnosed in 2023.
Thank you and welcome. And how about you, Antoine?
Hey, good day, everyone. My name is Antoine, as she mentioned. I'm out of the Atlanta area, Atlanta, Georgia. I was diagnosed with GPA in February of 2023.
Thank you. And last but not least, Irene.
Hi, I'm Irene Tipton. I'm also right outside the Phoenix area in Goodyear, Arizona, and I was diagnosed with GPA in 2021.
Well, thank you. And I'm so happy to have you all with us. We are looking forward to hearing responses that you have gotten good at giving to all those cringe questions that people have asked us. I know I was diagnosed in 2008, so I've heard a lot of these questions in my time as a patient living with vasculitis. And having said that, I'm just going to get started, and I'll probably call on you all to see if you have a question, and then I'm going to go to Dr. Banerjee right at the end and see if she has any clinical comments about what we've said and how we answered our questions. And the first one is, I've heard this one so many times, how can you be sick when you look so good? How bad can vasculitis be? Anybody want to jump in there? Irene wants to answer that one right away. Go ahead.
Well, I was just talking with my 10-year-old granddaughter about what I was doing today. And I said, what do you think of this question? And she looked at me and she said, you can't judge a book by its cover. Yeah. And I thought that was a great perspective from a 10-year-old. And I said, that's actually what I try to explain is, thank you for saying I'm looking better on the outside, but there's still a lot going on inside of me that leads to fatigue and some weakness. And I usually try to keep it short so that they just understand that what they're seeing on the outside doesn't always reflect the things that are going on inside our bodies. If it's somebody I'm closer with, I might go on to explain, the struggles with my kidney issues or sinus issues, but I think it's important for them to understand that our shell is not necessarily what's going on inside of our bodies all the time.
Well, that's a great answer. Anybody else want to chime in on that one?
Yeah, I think because sometimes where you like my natural, attitude in life is pretty happy and go lucky, and people see me as, just being normal. And we work harder to like fake feeling well than we do feeling bad. And sometimes that works against us. And like Irene said, you don't see what's going on the inside, and people have a hard time seeing you get up and get dressed and look normal. And like, again, Irene said, you just have no idea what's going on the inside. So it's tough.
Well, and it's hard to explain to other people sometimes if you're doing this for yourself. I always told people, even when I was doing my chemotherapy treatment, I got up, I got dressed, I showered, I put makeup on because I wanted to see in the mirror something that made me feel good about myself, not bad about myself. And so that's kind of what I explain to people sometimes. It doesn't mean that I always feel well, but it means that it's important to me to have a reflection for myself that will make me feel better instead of worse. Does that sound familiar to some of you?
Definitely.
Yeah. A lot of nodding heads. All right, well, let's move on to the next one. Isn't vascular, oh, I'm sorry, I was going to ask Dr. Banerjee, what are your thoughts on all that? I'm sure you hear these kind of questions from your patients.
Yes, so this is like a very common question. And as Irene mentioned, is like, how much do you want to tell somebody? If somebody is very close to you, you might want to explain, like, vasculitis is a disease. It's a multi-system disease. It may affect the kidneys, the lungs, and not everybody is getting skin rashes that is visible to other people. And obviously, particularly like GPA, initial phases of sinusitis, airway disease may look like common cold, and people may think, how sick can you be from just something that looks like common cold? But there is inflammation going on in the body. And also the other factor is all the medications, particularly, I think the elephant in the room is the effect of the prednisone, which affects mood, causes weight gain, makes you feel tired as we are lowering the dose of the prednisone. And all these things affect your day-to-day life, your energy level. So that is obviously not visible to other people. So again, it depends on how much you want to tell that person, how close that person is. I feel like, education is the key. So, telling them about, maybe referring them to the Vasculitis Foundation website, telling them that, this is a disease which affects internal organ system, which can be pretty severe, and you're being treated with very strong medications, and all of this can affect your overall health and energy level.
Well, thank you for clarifying that, because I think that was very important. Antoine, did you want to say something? No, it
Oh
looked
no,
like
I was just gonna add to that real quickly. When people ask me that question, I usually start off with that Forrest Gump phrase: "Life is like a box of chocolate. You never know what you're gonna get inside." That's how vasculitis really is. It's different types of vasculitis, different people or different systems impacted, and from day to day, you just don't know how you're gonna feel because of the medication, everything that the doctor mentioned. So that's kind of how vasculitis usually is for me.
Thanks. What a great answer that is. So I'm going to move on to the next question. Now I've heard this is strange. Isn't vasculitis just a treatable skin disease? And is vasculitis a form of cancer? So the misconception of what vasculitis is, it probably will get some great comments from Dr. Banerjee again, but I did want to say that I've heard is it a form of cancer when I'm in a medical office and they're going through the medications that I've taken, and some of medications are forms of chemotherapy. And I have to explain, it's not a form of cancer. It's a serious illness, and I was in kidney failure, and these medications restored my kidney function to a good level. But I'm interested to hear if you all have had that question and how you address these things. Josh, how about you? We haven't heard from you.
When people ask, especially if it's just a treatable skin disease, or if it's a form of, cancer because of those types of medication, I think, Dr. Banerjee had said it, best: education. I like to be able to educate them where, there's a difference between, cancer and vasculitis, even though I'm coming to the chemotherapy, office for an infusion doesn't mean that I have, cancer. I have this other form. So I like to be able to take that moment to educate. Um, and when they ask me, well, what is it? Um, I don't necessarily have all the information at the top of my head. So I like to be able to text or email a link to the Vasculitis Foundation that, here's a great resource that can give you some, additional information. And like you said, depends on the level of my how well I know the people and how well I know them and how much personal information I want to share. Mostly it's a general overview of vasculitis in a whole. But if they want to find out more information, here's some information to go to. That seems to help.
Well, that's a great answer. How about you, Irene? Do you have anything to add to that?
Well, it's interesting because when I was first diagnosed and I was going for my first infusion, I heard my husband on the phone telling relatives that I was going for chemotherapy. And I was the one who said, oh, don't use that word. They're going to think it's cancer, because I had that first impression myself until I educated myself. And so I wanted to make sure that they understood that chemotherapy is just a type of medication. We all just assume, we hear chemotherapy, we think cancer. So I was the person saying, pick a different word until I made sure we were both comfortable explaining the full details of this is a type of treatment and I do not have cancer, and explaining vasculitis as an umbrella term for the immune system, the attack on the immune system, and inflammation of the blood vessels. And so I usually try to keep it to that, and I say, and mine is this particular type. So that type of information usually satisfies most people, and then they understand it.
That's interesting. The reaction that you had when your husband was saying that, I get that. And I wonder if we've all kind of been in a similar place to that, where we're struggling with the medication that we're about to be given is often steroids and chemotherapy in the beginning, at least, or more so used to be. Now there are some other drugs, but anyway, maybe we struggle with, is it better to call it medication because it's good for us and it's going to help us get well? Is chemotherapy a negative term? Is that, Trina, you have a thought on that?
I was going to say, for my journey, it was interesting because my kids were 7 and 10 and I'm a single mom. So when I started, I was very honest with them with the journey. My daughter, especially, she was 10 and she wanted the truth and to understand. And so I used the word chemotherapy and I said, this is a medicine that's going to be used to help me. And I did lose all my hair. We had fun doing the wigs, and the kids, it was really interesting going with them through the perspective. And then a few months later, I ended up on oxygen for quite a while. And, I was also in a wheelchair for 6 months. So they saw a lot of the real day-to-day struggles that I went through. And so for me, I just realized with talking with them and being honest, that helped me explain, again, it is chemotherapy. The one that I was on the first time initially was really strong, and I landed in the hospital in ICU a couple times. So just being honest and real helped, because I was even struggling to understand even the concept of vasculitis in the beginning and how it affected me. So we really learned together. And like Antoine said, it's different with your family and friends or intimate people that are in your life, or other people that might be just a mild acquaintance. I didn't get into it as much, like why I needed oxygen, with my lungs or things like that.
Interesting mother perspective. We appreciate that. Antoine, you've got your hand up.
Yeah, I was just going to add to that usually I tell people I have IV drug therapy. so I don't even get into the conversation of chemotherapy, because the drugs that I take, they really are IV drug therapy, and they're not getting to, depend on the level of the individual, what IV drug therapy is. I may go into that and talk about some of the biological drugs that are used in IV drug therapy. But I stay away from chemotherapy because, like most, when I first started this journey, when I started researching and I realized that, oh, chemotherapy patients do take some of these drugs as a supplement to what they're doing as well. But the reason we're taking it, or I'm taking it specifically, it was for a different reason, and it wasn't chemotherapy. So I started using the word IV drug therapy and stay away from chemotherapy altogether.
Yeah, I like that also. I'll use that in the future for myself. Dr. Banerjee, I was wondering if I would love to hear your comments on this, but also about, should we be responding that it's an autoimmune disease, or is that too simple of a response?
Yeah, so it's so interesting. I'm glad that we are having this discussion. So as a physician who treats vasculitis, I like to use the term immunomodulatory drug. I do not use the term chemotherapy, because particularly when somebody is newly diagnosed, I feel like although some of the medications are the same medicines that the oncologists are using, we are using for a different reason. But I do tell them, like when you Google, I obviously give them material to read about it, but everybody Googles these medications. So I do tell them, like when you search the medication, you will see that these are used for cancer, and they are used for chemotherapy. But the reason why we are using it is for a different reason, to suppress the immune system, to reduce the inflammation. So that's how I explain. And again, we are, talking about how to communicate with people like your near and dear ones, and people who are like not so close to you, maybe using different terms. And I really like Trina's, explanation, like how she talked to her kids. It's very important for them to understand that, these are serious medications. So I guess it depends on who you are talking to, but I prefer to use the term immunomodulatory medication rather than chemotherapy, just because they're used for different purposes. And I do say, like, this is not cancer, and I do say this is so I use the term systemic always to kind of make people understand that this is not like a simple, like, skin vasculitis. Yes, skin vasculitis is a thing. Some people do get vasculitis limited to the skin. It could be secondary to medications such as antibiotics, etc. But then vasculitis such as GPA or EGPA, so these are systemic autoimmune diseases, so that people understand that this is something that affects the whole body and the internal organs as well.
Well, thanks for that extra help on that answer. I appreciate the way that you tell your patients about it. I did want to ask you about, should we be telling them, though, that it's an autoimmune disorder? I mean, and then just finish up by saying, basically my body is attacking itself. Is that simple enough for somebody, or do you think that leads to more questions? I just wonder what your opinion on that is.
Yeah, so that's how I explain to somebody who is like newly diagnosed with vasculitis. Like, this is a systemic autoimmune disease, which means that the immune system is overactive, and it starts attacking different parts of the body. In cases of, say, GPA, it affects the small blood vessels in the different organ systems. So that's how I explain.
Okay, thank you. I know that I've had that exact situation, and I try to say it as simply as I can. And sometimes it works and sometimes it doesn't. The next question is, probably most of us have heard this: as you've been diagnosed for a period of time and you were bad in the beginning and you got better, and you had some remission or quiet time with your disease. So people ask, what's the name of that disease you have, and what does it do to you? I can't even remember. And I think for me, I was diagnosed in 2008. So this is a very common question for me. Everybody was concerned about me in the very beginning. I had about 6 years of very heavy treatment. because I was in very bad shape. And then I worked really hard to feel better and to make myself healthier and to enjoy remission and everything. And I get that question a lot. Antoine, I think this is one that you had an answer for, and I'd love to hear your comment on this.
For me, I go back to that analogy I used with the box of chocolate to start off with, the Forrest Gump comment I made earlier. And I replied to him in that just, vasculitis, and I spell it out for him, VAS, and go out the word. And the reason I do that, because oftentimes people's attention span is short. And so I try to keep it simple. I try to keep it interesting for them, but I don't go into a lot of the details. I go into, hey, I have vasculitis. This is what it does to me. It makes me feel really tired, not just tired, fatigue tired, not just the tired that you want to take a nap, like the tired, I just want to zone out. And when I wake up, I'm refreshed and I'm ready to go. So that's what it does to me. This is the name of it. And then there's different names, and we usually refer to it by, alphabets or letters or acronyms, like mine's is GPA. And I refer them back to the vasculitis site or other sites if they want to know more information. But oftentimes, you usually will lose them after that first 5 or 10 minutes, because they really want to know what was the name of it, how you're doing, and then, make sure that you're okay. And so I kind of keep it brief in that little context. And, that's pretty much how I address it.
How about you, Joshua? You have any thoughts on that?
Well, especially for the people that, you can see that you're sick, or your friends and family around you. I think that was the hardest part, because for me, my EGPA had gone pretty much undiagnosed for several years. And during that time, I got really seriously sick, like Trina, in a wheelchair, unable to walk. You know, you have a lot of health implications when you are at your lowest part of the vasculitis, where people see you at your worst, where my health journey had led me into hospice before I was diagnosed. So people around were, saying goodbye and to an undiagnosed illness. So when I didn't die, and symptoms started to improve slowly, and there was that transition in learning how to walk again, and learning how to use your hands again, and even breathing on your own. People are very curious, and they want to know, well, what do you have? And there's a lot of questions, and what's the name of that? So especially with the people who I'm surrounded in our community, I like to be able to explain to them, and yeah, sometimes I can't even pronounce, the terms. So I tell them, it's EGPA, and it's a form of vasculitis, and it, cut off my blood supply, and my body was attacking itself, and like Antoine, you give those basic generic. But one thing that I have found very helpful has been the flyers from the Vasculitis Foundation, and having information, kind of ready, because like Antoine, people's attention span is very short. So even my doctors on my team, all the specialists in the team have had to be educated. I had to educate myself, especially coming out of hospice and into this specific diagnosis. And with the treatment, I use the word treatment instead of chemotherapy, because especially with my small children, I'm a father of 4 and 2 grandchildren. So we try to minimize, the specific information. So all of it is a treatment to help dad. But yeah, I like to be able to educate, and those flyers do help. And I've given them to my doctors, and I've given them to my friends and my family. So very helpful.
Super great pointers for those of you that are watching. Vasculitisfoundation.org. There's all kinds of information there. Trina, you had some comments for us.
Yes, I was just going to piggyback on what Joshua said too, is in the beginning, for some of us, that was our absolute worst. And explaining to people that there is no cure for this. And it's something that we'll always have. And for me, I use the term it's quiet, when I don't have a lot of activity. It's quiet right now, and a cold could put me in a flare, or who knows what could put me in a flare. But I also explain, on our good days, like Antoine also said, we are exhausted sometimes. It's not the tired, it's the fatigue. So if I do something during the day, I kind of have an easier night. Or if I know I have an event going on at night, I take it easy during the day. So that's what I explain to people. I've learned how to manage it for what works for me. And especially in my quiet periods. So I maintain. And again, the treatments are to maintain. And so it's different than in the beginning when it's so critical. And like you said, even when you were first sick, everyone's concentrating. And then once you get better, it's like, oh, you're better.
Yeah.
So I've tried to use the different terms of maintenance and managing it versus the initial onset of it.
Yeah, I think the longer you have it, the more you learn the terms that help other people around you. What do you think, Dr. Banerjee? Do you have any additional comments on that? I think everybody did a great job answering it so far.
So this is a great discussion, and I'm glad that to be a part of this. I'm hearing, your side, how you feel, and the questions. So I think education is the key, as you all said. Giving them the reference of the Vasculitis Foundation if they want to learn more, and also to kind of acknowledge the fact that this is a rare condition, and let your near and dear ones know that this is a rare disease, and explain to them the fact that this is not cured. Although I may look good, it is there. I am in remission. Some of you may need medications periodically. So education is the key, and going over, I think it is also important to go over the medications that you need and the effects of the medication as well, like you're immunosuppressed. So although you may look normal, the disease is still there. You may still feel tired. And also there are effects of the immunosuppressive medications and other effects of the medication that affects your day-to-day life.
Right. Well, thank you so much for that. I think we're going to move on to the next one. How long will it be for your vasculitis to go away? And is there a cure for vasculitis? We were just touching on this stuff, but I'm going to go to Irene because you look like you were ready to say something anyway. So give us your thoughts on that.
Well, it's funny because we tend to use the word journey for what we're going through. And I've told everybody who will listen to me, I prefer roller coaster. And so to explain that, we have these times in this disease that, everything is going smoothly. We're in the valley. We're enjoying that smooth ride. But anything could happen, like Trina was referring to earlier, that can cause a flare or cause things to happen. And so I will always have this disease in me. It's whether or not it can be controlled with medications, or some people are fortunate enough that they have gone and not required any medication to keep their disease quiet. And I, as we're going through this, I'm thinking I must have just really inundated my entire family and close friends with so much information that they really haven't come back with too many questions for me, because I really wanted them to understand, like, here's what's affected. We don't know what's going to come, but we know medication can calm this down. And so whenever I respond, I think they understand where, if I say to them, I am in a good place right now, things are going well, and we hope tomorrow will be the same. And so they've come to understand that today and tomorrow could look totally different as we go through this, but they understand this is something that I will carry with me till my last day, but whether or not it is having an impact on every aspect of my life and to what degree is always the question, and my doctors help me with that. And I have to say to Dr. Banerjee, hearing you say to your patients you're going to Google this anyway, but here's what I want you to know about your medication. I want to say thank you on behalf of myself. I think a lot of patients walk out of offices without that information. I think that is wonderful. So I know that's a late response, but thank you, because it's so critical.
Well, great answer. And I know we all agree with you on the answers we're getting from Dr. Banerjee. Such a great contribution to us. I think that question was very much a part of the one before it. So a lot of us have given our opinions on that. I want to just ask one more thing, and I'm not even sure how to exactly phrase this, but everybody here probably was really sick when they were first misdiagnosed and then diagnosed in most cases. Is there a way to talk to our spouses, significant others, people closest to us when they want to know is this fatal? I know that it's a really hard question, but I feel like it's something that Dr. Banerjee, if you have an answer for us, I'd love to hear what you have to say. And then some of you may have dealt with this with your people closest to you, and you may have an answer of how you handled it as well. Dr. Banerjee?
So one thing I would say that, it is important to bring your nearest one, your family, maybe your spouse, to bring to at least a couple of the doctor's visits. It's important for them to hear from the physician, your treating physician, the conversation that you're having with your doctor. And is this fatal? The answer is, depend on the type of vasculitis, extent of involvement, extent of different organ system involved. So in certain situations, if it is not diagnosed and treated early, it could become fatal. So it's important for your family members to hear what are the different organ system manifestations, what are the things to look for, and how important it is to get the treatment as recommended.
Thank you. I know that's a difficult question. Trina, did you want to say something about that?
Yes, I was going to say, I agree. I actually brought my parents to the doctor's appointments with me, and I was in the hospital for several weeks before the initial diagnosis because there's so much I couldn't understand. I wasn't in the right mindset, just really sick. And so, yeah, my parents went with me. And I remember one time my mom asked the doctor, did we catch this in time? And he said, yeah, she's breathing. So, and he said, organs first, that's what we need to concentrate because it got so bad. And even later, another time in ICU, it was pretty tough with oxygen staying, in the 70s and having to do some of the high flow oxygen and challenges with that. And so, yeah, I think bringing someone definitely does help because we're not always, in the right mindset on our really bad days.
Yeah. And Joshua, you were nodding your head. What are your thoughts on that?
Thank you. Definitely, I feel like, having your spouse and your family, having a support team and having a support system, or at least, and if you don't have a support system, most institutions can have somebody there with you at an appointment. And so having that conversation with your family is difficult, but having them on board and so having them hear things, we kind of we shielded a lot of people at first. I mean, we had our small group that was intimate family that knew about how things were progressing, and it wasn't until after palliative care and hospice was coming on board that we had to start having that conversation with our children, and that was extremely difficult to have those conversations, and but we kept it as positive as we could. and without using a lot of the medical, lingo, but also enjoying the time that we have. And then during that whole roller coaster, that I'm gonna now use from now on, Irene, um, having them see that, and having them as part of that whole journey and roller coaster was a blessing. And I think a lot of the family that didn't understand that was what was going on had thought, that I was over exaggerating. People can feel like we're over exaggerating our symptoms, and oh, it's all in your head, kind of thing. I think we've heard that before. So having that confirmation by the doctors and your team is very helpful for everybody around you.
Really good points. Irene, I know you're going to say something on this one.
Well, when I first started to get sick, it was right about the time that COVID had hit. And we were in such isolation that really my husband was the only person who saw what was happening to me. And so that was really difficult to explain to people, like, she doesn't feel good, we don't have a diagnosis. And there were some terrifying times when I just didn't feel like I was being heard by my medical team at the time, that we did. I would say to him, I don't know, it might be an autopsy before you know what's wrong with me, because we were that terrified. So that was pre-diagnosis. And like I said, going to doctors, everything was so different during that time. They didn't want extra people in offices with you. But once I got that diagnosis and we had a name and there was a treatment plan, that changed our perspective so much, because now we knew what I was fighting. And even though I was still terrified, I'd lost, 50% of my kidneys at that point. And it was permanent, and we knew that. But that, for us, having that information put us at a whole different level. And it allowed us this idea of enjoying the time we have. So it took us a while to shift into that. I'm feeling good today. That was a good half hour, and enjoying those parts of it. But pre-diagnosis, so much fear and uncertainty. And even though there is uncertainty here, I think having a name and knowing treatment allowed us to move on and try to make plans for how we can continue to live our lives.
Thank you. And Antoine, did you have anything you wanted to add to that, or did we cover that stuff pretty well for you?
I think Irene touched upon a lot of those points. I mean, for me, not having the diagnosis or knowing what it was created its own separate anxiety from the disease itself. And, for me, having my spouse there with me, I think Trina mentioned this earlier, because you're so out of it and trying to digest everything, having an extra person there to hear what the doctor is saying, to take in the notes and making sure that, you're following the process that they're going through was a tremendous help for me. So I always try to stay positive. So I never thought about the fatality of it. I knew it existed. I knew that we were still in some dark days, but I just kind of kept a positive attitude about it. And as far as, trying to get the diagnosis, and, that was a whole nother set of questions down the road we'll probably hit on. And then, once you got the diagnosis, being able to stick with the protocol and the plan and being able to get to the other side. And like Irene said, it's a roller coaster. So I'm enjoying this taxiing to the final journey of the ride here, or at least this phase of the ride.
Right. Well, I will say that I know that was a difficult question. I wasn't even sure how to put that question, but I do remember it in my initial treatment. I was in the hospital for 21 days, and there was one day that there was a crash team involved, and so it did come up. And it sounds like, in summary, that having this conversation really needs to involve a doctor, and not to speculate on it yourself or wonder yourself, but you should get the answer, and you should get the answer with your partner. Dr. Banerjee, anything to add to that before I move to the next one? I know we started with you on that one.
Yeah, I think these are like great points, and I agree to what has already been said. Like, it's important to kind of go over the extent of the disease, what the treatment involves, and have your family or your spouse with you during the discussion. That's very important.
Well, I appreciate everybody's answers on that. I think everybody did a great job on a difficult topic, and we all try to stay positive, and I appreciate that too. And we're all going to use the word roller coaster from now on, the term, apparently. This next question, I'm actually combining two of them because we already touched a little bit on the fatigue topic, but we get that question all the time because we can't do things or we can't participate in certain activities, and there's no real good answer other than the fact that I'm so body tired, I just need to lay down and leave everybody and everything alone for a few minutes. So I 100% get that, but it is true that people in our lives and other patients that we've talked to in their lives feel that they are exaggerating their situation, or maybe crying for attention or something like that. They do not understand that we are bone tired and we cannot put one foot in front of the other sometimes. And I'm just looking for comments on that. I think I'll go to Joshua. I did want to say that I saw a quote a couple of days ago that I wanted to bring up when we got to this question, which is, people with rare diseases don't fake their symptoms, they fake being well.
Mm. Oh gosh,
Mm.
that is so true.
I
That
saw
is
that.
so,
I saw that when we were preparing for this, and I'm like, that is everything. But Joshua, I do want to hear your input on this.
wow, that is absolutely very true. That you know, wow. When people have, and I've had close family members even say that, oh, you're over exaggerating, or can you really be that tired, or is it really that bad, or um how bad can it really be, or it's all in your head, you're making it up. And it was hard to be able to do that, and I've told them, I can understand how you can think that, um but this is really how I'm feeling, and um it really is this bad. I'm not gaining anything out of this. I'm not getting any, I'm not trying to get any attention. And like Irene had said, during COVID, it was actually a great time for us and our family, because during COVID is when everything got worse. And so again, no one really got to see me at my extreme worst. No one saw me at while I was on hospice. And then, after the pandemic and we started to go out, and people thought I was dead, and then all of a sudden it's like, well, you're alive, and oh, were you just faking it to get attention? And um,
Mm.
it's just one of those things that I've had to, explain to them, and that gives me an opportunity to tell them what it is, and especially the fatigue that's involved and all the symptoms that are involved with it. And again, like we talked earlier about how much information we share with who, around us. So
And I want to, that very heartfelt answer just then. And I know that this is all important to all of us. And I just want to go to Dr. Banerjee for a minute, because for all the people that are watching this webinar, we're all going to share it, so we hope it's shared a lot. Someone who has vasculitis and they live with this fatigue, and it's part of the vasculitis. What about vasculitis makes us feel so tired? Is there a better way we can explain it to people? I mean, I feel like we need a good clinical response here.
Yeah, this is a very common question that we get as, rheumatologists, vasculitis specialists. So I will start by saying that, be kind to yourself. this is not you. You're not alone. It is a part of the illness, part of the medications that you are receiving. So you're not just being lazy. As a clinician, what I would say, this is what I tell my patients, fatigue is the hardest symptom to treat. What I always suggest is try to think about what could be the potential treatable causes, right? Having vasculitis doesn't protect you from common illnesses such as sleep apnea, such as hypothyroidism, medication side effects. So the first and foremost, go over your medication list. We often prescribe you medicines for symptomatic relief of pain to help you sleep. Are there medications on your list that you could potentially remove that can contribute to your fatigue? I'm not saying that's everything, but trying to look for potential reversible causes of fatigue. Second is, we have to make sure we are not missing anything here. Did you develop sleep apnea over the last few years or few months? Is there any thyroid issue? So making sure we are like checking all the boxes. But even with all this, I will say fatigue is a very common manifestation from vasculitis. It could be related to the systemic inflammation. So our goal is to treat the inflammation as much as possible. But as you are saying, you may be in remission, but the fatigue may still persist. And basically, you have to acknowledge that, concentrate on the lifestyle modifications such as, exercise as tolerated, eating healthy, trying to get adequate sleep. So do as much as you can, more like a holistic approach, talk to your clinician. But, even with all these measures, there could still be some amount of fatigue. And it is important for you to be kind to yourself, to acknowledge the fact that, okay, I have to pace myself. As I think Trina mentioned that, like, okay, if I have something planned in the evening, I have to take it easy during the day. So I do talk about this a lot in the clinic, that you have to pace yourself. And this is really the hardest symptom for us to treat as well.
Great answer. And Trina, you've got your hand raised. You want to contribute?
I was just going to share too, for those that don't live in our household, it's hard for them to see some of what it takes just to get out of the door. I remember in the beginning when I would take a shower and I would have to take a rest. I'd have to take a little nap after before I even get ready. And just to get out of the door, I was exhausted. And like Antoine said, it's not like taking a nap helps. I could sleep for 20 minutes. I could sleep for 2 hours. I still wake up exhausted. And so also the spoon theory I heard in the beginning, and that really helped me when I Googled that. If you have 12 spoons in a day and it takes 2 to shower and it takes 3 or actually 5 to do housework, I pace myself differently, where housework I would do a little every day because I could not do my normal one day to go from one end to the other. I could not do that. So the fatigue, what we do just in our own house was different because, again, our loved ones that live with us or around us see that. But the outside world, they don't see what it takes just to get outside the door. So learning, like you guys said, to manage, the time. If I have errands I have to run, I'm not going to do things in the house that morning or anything like that. So.
Well, and like Kathy had said at the beginning, we try to put on this mask of we try to mask that fatigue and we try to mask our symptoms so that, we are looking normal and that we are doing that physical activity. And I think sometimes we don't put ourselves first, and we try to, continue to run ourselves ragged and to keep up. And then that makes us even more fatigued. I find, at least for myself, I'm trying my hardest to keep up because I want to feel normal. And then I realize, oh, I'm still really sick. I'm still really, that really made me tired.
And I'd like to add, Kathy, that when I explain my fatigue, I try to add in letting people know what high dose prednisone does to the body, depleting muscle. So I explained there's already fatigue that comes from the disease, But when you lose so much muscle, everything is difficult. So walking, we've all seen, elderly people who have lost muscle. Well, and I've tried to help them understand that that's about where I am. The idea of showering, standing up long enough to chop some vegetables to make dinner, but helping them really understand the effects that prednisone plays in adding to that fatigue.
Well, really great discussion. I am going to just throw in my 2 cents here, and I swear I'm not faking being well. I'm just going to tell you that I was diagnosed so long ago and was in treatment for so long, and then I was termed long-term remission off treatment for many, many years, which was really good to be able to. I'm from the fitness industry, so I tried to get myself back, which I never quite did, but I tried. I'm just telling you this because the summer before this summer, I went with my brother and his wife and my husband, and we went to Switzerland for 2 weeks, and I hiked and I saw the most beautiful things in the world. And there were 2 days on the 14-day trip where I said, I'm out. I'm going to miss whatever you do today. I'm just so bone tired that it's the spoon theory, Trina. I used 14 spoons yesterday and I only had 12. So I don't have enough today. So I'm just completely out. But I got to see what I wanted to see. And then when I came back, I was exhausted. So I just want you to know things are possible, but I still, even many years in remission, I had a relapse in 2022. So it's not completely all those many years in remission, but it's still struggle to explain to people, but not my brother. He planned this trip knowing that there were going to be days that I was going to choose not to do anything so that I could see something the next day. So I did the not very important days in the hotel room. So I think we all learned how to do that. Dr. Banerjee, anything you want to add to that segment we just did on symptoms and faking being well and actually feeling good and feeling fatigued before we move on?
I agree to, what you have said. And I would add here again, involving your near and dear ones, it's very important. I had once a mom come to me with her teenage children because she said she wanted her children to hear our discussion to understand why mom is not cooking 5 dishes over the weekend. And I found that I was sad, but at the same time, I thought that it was very important. And I learned a lot from that encounter, like how important it is to have your family members and your near and dear ones to be involved in your treatment decision making, how you're feeling, to understand what's going on in your life, in your mind, in your body.
Yes, what a great thing to do, because anybody that's had teenagers, they do need convincing from authority sometimes. Antoine, did you want to add something before I move on?
Yeah, just real quickly. I likened fatigue to kryptonite. Superman, kryptonite, it was always took him down. Rest is my restore. So I try to make sure that I balance between the kryptonite and the rest, so that, using Trina's analogy, so my spoons never run out.
Yeah, great. Everybody who watches this now is going to have to do a little research on spoon theory, but I also believe very much in that. And that's what that trip was to Switzerland for me, a lot of throwing spoons in the wrong places. So I wanted to move on to the people that ask us, can you not just eat healthier? Can you not just take vitamins and boost your immune system? Why are you still wearing a mask? All of these things kind of go together. And I actually had to tell somebody one time that if I boost my immune system, it could attack my body, that this is an immune system problem. And my father-in-law, who was a particular person in my life who was very dear to me and was very interested in vitamins and health. And I'm like, well, sorry, it's not going to work for me. So Dr. Banerjee, you want to say anything first before we move around to people's opinions of how they handle it?
Yeah, so I always tell my patients this, that there is no substitute to healthy living. And by healthy living, I mean, exercise as tolerated. I always use the term as tolerated because I'm not expecting my patient who has vasculitis to exercise an hour on a daily basis. I even say, if you can walk 2 blocks, if that is what you can do, but try to do something every day as tolerated. So exercise as tolerated, adequate sleep, and healthy eating. But I would stay away from supplements or, so-called, immune boosts, etc., because we do not know the effect of these supplements. These are not FDA approved on your immune system. So I would not recommend those.
Okay, thanks. Does anybody want to add to that, how you handle that in your life, Trina? Or
I know in the beginning with the, like Irene said, with the steroids, I gained so much weight and it did damage to my joints and everything. And when I was bad in the wheelchair for 6 months, I couldn't stand at the counter to brush my teeth. I couldn't stand, in the kitchen to make dinner. So like physically, it was just so tough. It took everything just to do what I needed to be mom. And so it sounds easy, like, oh, just exercise. But when it's your really tough times, when you're even debating, like you're laying in bed and at night and you have to get up to go to the bathroom and you want to cry because you have to get up out of bed. Like it is hard. And my journey has definitely changed now. And I could go on nice walks or hikes. And I'm going to the gym today with my son. I love these times, but it hasn't always been like that. So, again, giving ourselves grace on those bad days, is so important because there's nothing we can do on the really bad days. Nothing's going to fix it.
right, good point. And Irene.
I have had several people recommend naturopathic type things, vitamins, all of those things, and some quite insistently, this really is good for you. This is really good. And so I've had to be pretty direct and say, I know they're natural, but they are still a chemical. It's still something my body has to process. And I always go back to my kidneys. My kidney function isn't at the top. And anything I put in my body that I have not discussed with my nephrologist, it may not be able to process it. It might do more damage. And so I've really fallen back on, thank you for offering me that, but I've really gone through my doctors to make sure that everything I put in my body is going to be safe for me, because when you're sitting at 50% kidney function, that's where you want to stay. You don't want to go any further. And so I don't like to be that direct sometimes. I tend to try to soften things, but with a couple who really believe in those things and really it's helped them, I thank them, but I also have been pretty direct about it's something that would still have to be processed through this body of mine that's struggling right now.
Irene, that's really great that you said that with such compassion for the people that were trying to do something to help you. You delivered that message very well. I hope everybody paid attention to that. That was a very good answer. I did want to ask you all if you deal with the mask thing with people. I had the right type of mask. I won't even say which brand or type is the best, but I had this in 2009. So it was way before COVID, and had to wear it when traveling, and had to explain to people that I was not going to give you something. I was protecting myself as best I could from all the germs that were out there so that I didn't wind up back in the hospital. But I'm wondering, do you get that question now that COVID is over? People ask you that. Antoine, you're nodding your head. Do you get that question?
Oh, I get that question quite frequently, especially in Georgia where the temperature is over 90 plus degrees and you're wearing a mask outside. But you know, you try to be nice to individuals. And what I mean by nice is, um, you know, like you said, I wear the mask to protect myself from the germs that are out there and any potential germs I could come in contact with. But you know, also protect myself for longevity for my family because I want to make sure that I'm around for them. So when I look at the bigger picture, you know, to me the mask is just another something that I have on like a baseball cap. You know, I just put it on, I wear it. You know, of course, do I get the stares? I get plenty of stares in Georgia, and there are times when I have to switch out different types of masks because some of the masks, you know, you can't breathe in because of, you know, humidity. And so I switched them out, but I make sure I have something to cover myself. And even my doctors, you know, they always say, you know, the best thing you can do for yourself is protect yourself. And the mask is one of the best things to protect yourself. So I still wear the mask. Are they uncomfortable at times? Yes. Do I take them off at times? Yeah, usually if I'm in the car by myself, I'll take it off or something like that. But if I'm out and about in public, you know, I'll have on a mask. Sometimes I sit outside on a patio deck at restaurants. I may not have on a mask because obviously you can't the mask on. But when I'm done eating, I'll put the mask back on. And so, you know, I look at it as a tool to protect me and protect my longevity. So that's kind of how I look at the whole mask situation.
Well, that's great. And I just before I have one other important question that we wanted to get to, but I did want to ask Dr. Banerjee, do you give advice to your patients about should they wear their masks as much as, does it depend on how much treatment they're in? You know, just like, where do you stand on that? Does it depend on all the things that are going around?
Yeah, depending on you know what treatment they're on, how much glucocorticoid they're on. I do recommend my patients that, particularly when they are in a closed, crowded place like watching a movie, a theater, in a mall, I do recommend that they wear mask. And I understand that it invites some unwanted questions at times. And you all have discussed that. I think education is the key, and how much to educate depends on who you're talking to. But yeah, all my patients, I do recommend mask. But again, it also depends on their medications and the prednisone dose.
Yeah, those are some great reasons right there that we can clarify with people. And this one, I did want to touch on this one question because this is one that Antoine brought up, and I wanted him to have the opportunity to answer this. And then if any of you have any other ones that we have not done, Antoine, you got the question one time that someone said, I did not think people of color could get vasculitis.
Yeah, and Kathy, that was a question that took me aback when I first got it because it came from a healthcare provider. And I was kind of taken aback because I never thought about, you know, first of all, the disease is new and you're still learning about the disease. And so you don't get into all of the, you know, the racial demographics of the disease. But I did some research afterwards and kind of went through some things, and I realized this kind of the source of where that question was coming from. So when you look at the racial demographics of vasculitis in and of itself, you know, primarily 70% of Caucasians get vasculitis, and 30% of the rest of the population really don't get it. You know, that's African American, Asians, and then Hispanics. And so even that African American population, African American males, we get a small percentage of vasculitis. So it's a rare disease. And then for me to have it is even rare, if that's a term to use. And so I understand the place where they're coming from, but the real place is that everyone can get vasculitis. It doesn't matter your ethnic background. You can be, you know, your body can have this dormant disease and it can rear its head. And so it was an educational process for me as well, because I realized how rare of a disease I really had. I mean, you hear the term rare, but it's even rare when you break it down in between racial demographics. And then some of this has to do with reporting, you know, and the doctor, she can weigh in on this, you know, that cases may or may not get reported properly or misdiagnosed, et cetera. But, you know, my takeaway on that really is that it's a disease that can impact anyone from any age group, from any demographic, from anywhere in the world. And so it's not something that says that, hey, because you're X, you can get vasculitis. You can get vasculitis. You can get other diseases as well, and other autoimmune disease like lupus, which, you know, typically people in the African American community get diagnosed with lupus. And you do the research, lupus and vasculitis have some overlaps between the two of those diseases. So Yeah, it's quite interesting, but it's quite fascinating too when you look at some of the numbers and the data behind it.
Great answer. Thank you for bringing that up. I did want you to have the opportunity to address that. I did want to switch back to Dr. Banerjee and see if you had any comments on that. That was a question that Antoine brought up in our earlier discussion.
Yeah, and I think Antoine explained it very well. Like anybody, any color, any race, any age, any gender can get vasculitis. There are different types of vasculitis. Some of the vasculitis may have a predisposition towards one particular type of ethnicity, but then it's very heterogeneous. And I would also add that also depends on, because it's a rare disease, and how much these diseases are studied in different parts of the world. I think that also contributes to our knowledge. So we need more studies, more data on, different parts of the world to really understand the epidemiology of the different types of vasculitis. So really, education is the key.
Well, thank you for giving us your thoughts on that. I appreciate it. And we want to end this discussion on a positive note. We understand that our friends and family ask these questions, and we hope they understand why these assumptions make us cringe. But we hope you can invite those of you that are watching this, invite your caregivers and friends to watch this, to be part of the discussion, so that we're just trying to help them understand how we feel and where we are, and better responses, positive responses, not negative responses. So we hope that that's what we've created in this video today, this webinar today. I did want to share one thing with everybody here towards the end. We want to say thank you to our guests. First of all, Antoine, Trina, Irene, and Joshua, thank you so much for your perspective in this. We really appreciate the time that you gave today so that other patients will know how to deal with these things. And Dr. Banerjee, the same thing to you. Thank you so much for the time that you spent and the clinical answers that you gave us, so that we had what we like to think of as some authority when we're responding to our friends about these things. And of course, we also would like to thank our sponsors, Amgen, AstraZeneca, and Novartis, and the Vasculitis Foundation for just for sponsoring these patient education webinars and just always keeping this at the forefront. So thank you, everybody.